Happy Tuesday. All right, Dr. Stefanski, as you know, is here. She'll be speaking in just a minute about COVID numbers and flu season that will be cranking up here pretty soon. We also have Corey Williams. He's with the Small Business Association, and he's here in case you have any questions or and to provide you some more information about the FEMA disaster assistance that Lafayette Parish was added to yesterday, along with some other neighboring parishes. So again, with that, we want to put out a reminder to businesses and residents that the statewide mask mandate is still in place, and the number of people is still limited inside businesses, event centers, and limited for outdoor events, gatherings, and churches. The state fire marshal handles all those complaints, and between October 25th and today, Lafayette Fire Department fielded 23 of those complaints. They then input those into the database, and the state fire marshal's office follows up with those complaints. So I have some information about debris pickup and other resources, but first I'll let Dr. Stefanski come on up and share some info with you.
Thanks, Jamie. And I've been on the road, so y'all may have updated numbers and all that I have on my phone. So if y'all have got those specific questions, I may have to review some of that. So I just want to thank Jamie for the invitation to come in and talk with y'all today. We still have our medical task force, Lafayette Consolidated Government Medical Task Force, that meets. Now we're meeting every other week by phone. And so I mentioned on the call that we had earlier this week that there's definitely a concerning increase in the number of cases that's really accompanied by, a couple of weeks of maybe not, not quite so great compliance with the preventive practices that are recommended and that are actually required in Phase 3 of the governor's executive order. And so, Jamie invited me to address you all today and answer any questions that you have. And also, I'm here to ask you to please encourage, or to share this message or take this message to your readers, your viewers, because it's concerning. So just a few little points. So COVID-19 remains a highly contagious and deadly disease. That has not changed. There's a lot of noise that's distracting and a lot of false information that's being shared. But again, it is a highly contagious and deadly disease. There is hope on the horizon. We're hearing about vaccine, from some of these vaccine trials that, by as early as late this year, we may start to see some safe and effective vaccines available to us. Now, certainly that won't be available to the general public or the community at large until later in 2021, but it's definitely a hopeful sign. So, we just need the public to stick with us, to remain vigilant and follow these preventive practices that are tried and true. There's just no reason for debate here. They're tried and true, and we can get through this. But to just give you an idea of where we are today, I know you all are noticing that we've seen an increase in the number of cases over the last couple of weeks. We're also seeing now an increase in emergency department visits, and that's very new information that I got right before I came here in most regions of the state. So we're seeing an increase in the number of cases, number of individuals who are testing positive, the number of individuals who are seeking emergency department care for COVID-like illness. It's not a surprise. And we're just also starting to see a slight increase in hospitalizations. So we've been here before. This is where we were, in June. I know y'all remember what happened. As a result of that, we don't want to get back to the point where we were before. It's just really critically important that we intervene now so that we don't end up with that peak in hospitalizations and deaths. And I think a number that we don't talk about a lot is deaths. And so in this region, just from, as I put my glasses on, from July through November, we've had over 430 deaths from COVID. And so that's not that first increase that we saw earlier this year when COVID, first reared its ugly head. This is during that second increase we saw this summer. So from that point through now, we've had over 430 people in our community die from this disease. More than half of those, more when we look at community versus nursing home deaths, we definitely saw with that second increase community deaths, as we saw, the increase in community cases outweighed the number of deaths in nursing homes. Our nursing homes are doing a tremendous job in protecting their residents and their staff. They're still doing weekly testing at minimum. So we're seeing very little spread in congregate settings. These increases that we're seeing are in the community. So again, we ask the public's help in turning this around. It's not too late. This is the right time to intervene. We know we're starting to see that increase. That means the virus is more prevalent in the community. So follow those preventive practices that are tried and true: good hand hygiene, physical distancing between you and other individuals, and wearing a mask that covers your nose and your mouth. So proper mask wearing when you're outside of your home, and certainly in contact with people. Those are, again, just the three basic preventive practices: good hand hygiene, physical distancing, and mask wearing. And plead with the public to take this seriously, because lives are at stake, the health of our economy is at stake, and the health of our and the vitality of our healthcare system as well. So that's really it from me. I don't know if you have any questions.
You mentioned ER visits. That you just got this information. Do you have any specifics?
Yeah, let's see. I'm gonna.
And I'm assuming these are ER visits related to COVID.
COVID-like illness, right? So we still these are just here we go. Really, these are percentages of individuals who seek emergency department care for COVID-like illness, and that's in just about every region of the state. We're seeing those increases. So that's about as much information as I have right now. I just got that information, and also know that flu. We're seeing very low levels of flu activity. So, as we know, as time goes on, we're going to look at these COVID-like illnesses through the emergency department, because COVID-like symptoms are very similar to flu-like symptoms. But right now, we're seeing a very low rate of flu activity in our community. So these are the early indicators. And so y'all have heard this before, hospitalizations and deaths are lagging. So when you start to see the increase in the number of cases, the increase in the number of emergency department visits, that is very predictably followed by an increase in hospitalizations and an increase in deaths. So, for everyone out there listening who's, distracted by the noise, please think about, again, the health of your mom, your dad, your neighbor, the person you're encountering at the store. High-risk conditions for this disease are very common: hypertension, obesity, kidney disease, heart disease, advanced age, and by advanced age, we're talking about 65 and older. That's people near and dear to all of us, and so we need to protect our community to protect those individuals.
You mentioned there's still hope on the horizon. Do you know, with the Pfizer vaccine, I know that's something that's been in the news lately, but do you know what still needs to happen before it's given to the public, or before the public can have access to a vaccine?
Sure. So, so this is something that's happening very quickly. So we're getting information just like you all are. But it's my understanding they're still in clinical trials, and so once those clinical trials prove that there's a safe and effective vaccine, it's then got to go to the FDA and through a process for emergency use authorization, if not FDA approval. And so those are all steps that still have to that will still have to take place. But I can tell y'all from the public health side, we're certainly gearing up and getting ready, because we suspect that as soon as the vaccine is released, we're going to need to get it out as quickly as we can. And so we're working to make sure that on our end we can operationalize the administration to the priority groups. And so first, the vaccine will have to go through finish those clinical trials to prove that it's safe and effective. Then there'll be a prioritization, and that will likely be, as y'all can imagine, the high-risk groups, congregate settings like nursing homes. And so those will be set by the federal government, by the Centers for Disease Control, and then we will work along with our private partners to get the vaccine to the individuals that need it. So we don't really have a timeline yet, but it's very hopeful that maybe by the end of the year we'll start to see the vaccine, at least small amounts, at least for those who are at high risk.
And you mentioned the flu season. Is it kind of a milder season this time?
Well, so far, and it's so we're just in November, so it just depends. Usually this is November, December is when we start to see the biggest increases in flu cases, with a peak usually around February or March. So the hope, however, is everyone's going to get their flu vaccine, because we certainly don't want two respiratory viruses circulating. And oftentimes those people at highest risk for complications from the flu are those same who are at highest risk for COVID complications. So everybody should get their flu vaccine to protect themselves and everybody around them. And we're also hoping that these preventive practices will help to decrease the spread of flu. Mm-hmm.
How much do you think it'll cost for a vaccine for the community? I know actually the just
Yeah, sure. So it's my understanding that there'll be no cost to the individual.
Okay, awesome. And then do you know if will there just be shot the vaccine? How will it be serviced to people? Will it just be shots or?
Sure. Yeah. So right now, it looks like it'll be a vaccine, an intramuscular, or well, we'll have to see what the delivery is, but definitely a shot, an injectable vaccine.
When it is offered, who will get it first?
So the way it works, the Centers for Disease Control and the American College on Immunization Practices will set prioritization levels, and so likely we expect those priorities will be people at highest risk, people living in nursing homes, perhaps healthcare workers, first responders who are at high risk themselves, likely will be the priority groups.
And as far as like research, I know like she just mentioned this, the Pfizer thing, whatever. Like, what are some sources that we could trust to know for sure that we do have a vaccine?
Sure. So I would say Centers for Disease Control, us, or Department of Health, we'll follow all of those, all of those studies very closely. And any vaccine that's released will have to go through these rigorous processes to ensure that they're safe and effective.
Okay, so nationally, we're in a really kind of like peak spread level of the virus, but Louisiana's been kind of left out of that, fortunately. Is there any explanation for that from the Department of Health? And then I guess what's the level of concern that the state will catch up with that surge as we enter the colder months and the holiday season?
So I think, when you look at our graphs, and I was looking because I tried to print some of those. When you look at our graphs, I really, really think that our success to date, but I say success knowing that there's still people hospitalized and dying from this virus, but compared to other states, has been the mask mandate. We saw what happened when you look at our epi curve. So you look at the number of cases, the number of hospitalizations, the number of deaths, everything. As we went through the stay-at-home, which is what no one wants to go back to that time, we saw the big decrease. Then as we started opening up through the phases, we saw those increases. And then with the mask mandate, the cases dropped off again. So I really do think it's great leadership in our state. Quite honestly, they're sharing good information. This slow reopening to try to limit the spread of virus to individuals who are in these businesses working, their patrons. I think all of those or have been keys to our success. It's just, I think we've all seen the practices in our community where people are starting to kind of relax. We were doing great for several weeks with a pretty low level of virus in our communities and a pretty stable level of hospitalizations. And I think, lots of people let their guard down. And so I think it's really important now is the time to kind of step it up and double down. And it's hard to find many different ways to deliver the same message, but, these are just, again, tried and true practices. We saw them work this summer. When, frankly, our hospitals, and y'all heard from those, the chief medical officers of these hospitals, there's a real concern for staffing, capacity, everything for our healthcare system. And that, again, should concern all of us. We don't want to get back to that point. And this summer, and again, not to speak for the hospitals, but the summertime is usually when hospitals are at their least busy, essentially. And the fall and winter is when hospitals are at their peak capacity, typically. And so when you add COVID to that, this fall and winter, that really could be devastating. And that's, we can't get to that point. And I do think we've got all the tools, in place to avoid that.
Since we're in flu season, are there any concerns that someone could get the flu and COVID at the
Yes.
same time?
Yeah. And we don't have a whole lot of information on what that looks like yet, because when COVID in the spring, we were seeing the drop off of flu cases. So we don't have a whole lot of experience in large numbers of people who are co-infected with the flu and COVID. So again, another great reason to get your flu vaccine, because we don't want to have to figure that out. And I do just want to say that our hospitalizations, again, have been increasing. We have 14 new admits from in the last 24 hours for COVID in our hospitals in our region. So we had been just looking, we track this, we track all of this. We'd been hovering the 50s, 60s, and we, the numbers, fluctuate, of course, from day to day. But today's hospitalizations are at 81, and that's COVID hospitalizations in the region. So again, we had been in the 50s and 60s is pretty stable for the last couple of weeks. So again, today we have 81 as of right now, and that's of course a number that's going to continue to fluctuate with admits and discharges. We have 81 individuals hospitalized and 9 individuals on vents. And so again, we see the increase in cases, the increase in hospitalizations. So it's painting a pretty consistent picture.
Can you inform us on behalf of the hospitals, just because you speak with them every day, but are they moving back into phased plans, or can you tell us what they're doing to prepare for a potential third, other spike?
Now that I'm not sure. I don't have that. Yeah, I don't have that information.
With Thanksgiving and Christmas coming up, and basically a pretty consistent history of big holidays leading to big spikes, what's the level of concern there for public health officials? Because it just doesn't look good.
Right. So again, the concern is do everything you can now to, to again double down so that we have that level of infection, so that we lower the level of circulating virus. Because we know those individuals who are at highest risk are those same individuals who want to celebrate and participate in family gatherings. So I think we all need to start thinking about now, how do we protect those individuals? So, y'all probably have heard these same messages as I, messages I'm getting ready to speak, but it's kind of common sense. So best to celebrate with individuals in your household. That's the safest thing to do. If you are going to bring together a smaller group of family and friends who you would typically celebrate the holidays with, keep it small. We don't want people traveling all over and congregating in big groups of people. That's just a recipe for disaster. So keep those gatherings small, and then also think ahead. So now is the time. If you know that you're going to be celebrating Thanksgiving with someone who's at higher risk, so someone who's older, someone who's got a high risk conditions, start now limiting your interactions with other people, because then that will further reduce your chances of being exposed and then able to expose them if you're an asymptomatic individual, for example. So think ahead, knowing that the incubation period can be anywhere from 2 to 14 days. So a couple of weeks out, start to decrease some of those activities that you might have engaged in where you encountered more people in order to protect yourself, to protect them. And I also want to say we continue to have daily testing at the Lafayette Parish Health Unit. So Lafayette Parish Health Units, this is an effort between Lafayette Consolidated Government and the state. National Guard is out there every day. They'll be off tomorrow because of Veterans Day, to celebrate Veterans Day. But so we're there. It's no-cost testing. And I'm hoping that they'll be there for a couple of weeks. Drive-through, easy. Takes a couple days to get test results. We're on UL's campus, and we've been there for weeks. They've been a huge partner, a tremendous partner with us. And so also, be tested, get tested if you are going to be visiting with individuals who are at high risk during Thanksgiving. But I would say there's lots of guidance and suggestions on how to celebrate safely, and start looking at that. Y'all know the recipe for increase in spread. So there's certain settings where COVID can be spread more easily, and that's crowded places with many people nearby, close contact settings, especially when people are close to each other and having conversation. You can see how the spread of droplets can occur. And then confined and enclosed spaces with poor ventilation. So outside's better than inside, spread out. Those are kind of important tips that if you're going to be celebrating, think if there's ways to move it outside or spread out. Open windows if you're going to be inside to increase ventilation. Don't hang out in the kitchen like we all do, next to each other, helping each other. Think of some safer ways to accomplish the same idea.
Question for Jamie. There has been an increase in people patronizing downtown nightlife, and some of the establishments have been promoting their events more frequently, including indoor live music. Is the administration considering any kind of effort to restrain that at this point, now that we have higher numbers coming?
What we're doing is, again, when we get those complaints, we're we're reporting those to the state fire marshal's office, and from there, because it is a state mandate, the state fire marshal's office decides on what action to take upon that business. So,
Okay, but so LCG has on its own taken actions in the past for different, in individual cases. So is this a change in your approach to enforcement? Now, are you just shuffling everything to the state fire marshal?
well, during that time, we had a local order in place. Mayor President Guillory has not renewed the local order. So again, because it is the governor's Phase 3 order and the state fire marshal is overseeing that, we are, again, like many areas around here, inputting that information into the state system.
And you do have the authority to conduct enforcement if you so chose. I mean, these are peace officers, correct?
Again, I'm not going to speak definitely on that because I don't know the legal stuff behind that. So I would refer.
Okay, and some of the enforcement on some of the establishments in Lafayette have related directly, on the citations, they relate directly to the governor's order. It's not about a local order. So again, is there a change in your stance and your approach to enforcement?
Again, when we get complaints, we address those complaints and we refer them to the state fire marshal's office.
Okay, did you mention the number earlier? Was it 23 or something?
23.
23 what?
23 complaints.
Since,
October 25th.
okay, so there's been 23 complaints since October 25th related to the governor's order, or complaints of violations of the governor's COVID orders. Is that correct?
Correct.
Okay, and can you report on what has happened since those complaints?
I cannot. Again, that information is from the fire department. I don't have information on the specific complaints.
What stops Lafayette LCG from conducting its own local enforcement? I mean, you say it's a state fire marshal, it's a state issue, but nothing is stopping you from doing it, correct?
Again, I'm not going to speak to that. I don't have that specific information. I can try to get back to you.
You don't have what specific information?
The reason for why it's handled the way it's handled, but like I said, I'll get back to you. Anybody else? All right, that's some additional information to put out real quick. Oh, yeah, sure.
I also want to just make the case for if anybody's looking for another story angle on behavioral health issues. And so, we're in a pandemic. Pandemics are, right, stressful. And so I think on all levels, we know parents, adults have lost their jobs, are stressed. It's very anxious times, to say the very least, for them. You have older individuals who might be worried about their health and are home and isolated. You have young adults who are also more socially isolated, worried about their parents, worried about their grandparents. So this hits all ages. And we really want people to know. We want people to know that there is help out there. There's a great national suicide prevention hotline or lifeline where individuals can call and speak to a counselor. We have a Keep Calm line through the Office of Behavioral Health in Louisiana, again, similarly, where people can call and talk to professionals. So we just want people to know that they're not alone. That if someone's sitting at home and is feeling isolated or stressed or anxious or worried about their child who might be feeling the same things, this is around the country and the world. People have these same feelings. We want people to reach out. There are people out there to talk to individuals and help give them some guidance and hope. And again, there is hope on the horizon with this vaccine. And so again, that just one last message. If you could share that information, that there are these hotlines that are available to individuals who are concerned and not knowing where to go for help or how to seek help for themselves or perhaps their family members. And then also reach out. I've said this many times before. Reach out to the person in your family, your friends, your neighbors who are isolated or older. Phone call does wonders and can help people. Can help to brighten someone's day and make them realize that they're not alone and that they do have someone that they can talk to. So I do ask that people continue to think about those who are more isolated or at highest risk and call and talk to them. See if they need you to pick up something for them at the grocery store, because they're hearing this and becoming even more concerned and might be less likely to want to get out of their house, understandably. So just look out for your neighbor and be a good neighbor. And when you are out and about, wear a mask. I plead with businesses, our local businesses, really understand that the phase 3 orders are still in place. There has been no change. People are required to wear face coverings when out in public, and that goes for the people working in these establishments. So business owners, please, understand that. And then also, I've seen pictures over the last couple of days of these crowded bars, and we're going backwards. That's definitely, again, very predictable pattern. We saw what happened this summer, and so we ask that people read the phase-free guidance, understand what that means, sit at tables, remove your mask when you're eating and drinking, put a mask on when you're out and about, and those crowded, poorly ventilated spaces where people are close to each other, and having conversation is the perfect place for COVID to spread. And it's we again have all the tools in our hands.
With question regarding the rising cases, do you think that LCG should enforce restrictions on bar occupancy?
That's I'm not going to get into that. I really hope that the people listening, that parents and young adults and business owners understand that, hey, this phase 3 guidance is there for a reason, and we should all voluntarily comply with it.
Your contact tracing doesn't show spread from bars at the moment.
At the moment, correct. Yes. So, right, but we know that it's going to take, first of all, people have to be honest with the contact tracers. So we only have the information when we call an individual. They have to be honest with us when reviewing their past activities or the activities in the last few days. So that we depend on individuals to please remain honest with our contact tracers. And also, we know it takes a little bit of time based on what we saw this summer from those kinds of settings to then translate to an increase in outbreaks. But that's when you get to that point, you're really too late, because then you've kind of had that big group of individuals who are then able to spread this virus. So.
And is it also not, correct that some of the people, age-wise, who are in the bars that we're seeing in these photos online are in the age group that are being
right.
infected?
That's what we're seeing. We're seeing that increase in the younger adults, and so that is, talk about from the K through 12. We're seeing that in the high schools. Where kids are getting together socially, and we're seeing increases in cases there. And then we're also seeing cases in young adults. And so we'll wait to see over the next couple of weeks if we start to see outbreaks, tied to particular settings outside of these kind of private gatherings, which we don't have any evidence of that yet from our contact tracers. But we can certainly look at the pictures and hypothesize that or that we might start to see some cases if something doesn't, we just might start to see additional cases in those settings. So let's change course and slow things down and get back to common sense practices. Thank you. Thank you, Jane.
Thanks, Doc. All right. I'm going to switch gears a little bit and talk about hurricane recovery. As far as debris pickup, still ongoing. There were 27 trucks on the road today in 11 of the 18 zones in the parish. 6 of the 18 zones are complete. That's 3, 4, 5, 6, 16, and 17. Zones 8 and 13 are expected to be complete either today or tomorrow, barring any problems. And so far, the contractor has picked up 262